when I talk about non-stress test, and this is the importance because we're going to talk about a contraction stress test, and it is different, and in regards to interpretation, they are almost completely opposite. So please do not get them confused. So like I said, we'll go over this again, we'll go over the strips again. Don't worry, don't freak out. But we're still talking about a non-stress test. There's two indicators or interpretations of this test. You have reactive versus non-reactive. This is in box 10-8, page 263. The strip you are currently looking at is a reactive non-stress test. What does that mean? Before we talk about that, I'm going to show you. I'm going to see if I can blow this up. And I can't, I just make marks on it. Okay, never mind. So when we talked about the little square, this teeny little square here, is 10 seconds in time. Then if you look at, this is a dark mark, and then right underneath the numbers is a dark mark. That's your block of 6, which makes it 1 minute in time. So if you count, you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 minutes in time. Top, remember, is fetal heart rate. Bottom is contractions or uterine assessment or movement, which is essentially mom. So when we're looking at these strips in relation to mom's movement, in the very first block, you see mom has some type of uterine movement. When we try to determine what is a normal baseline for baby, we're going straight down the middle of this strip. So from the looks of this strip, this baby's heart rate is running normal heart rate around 130, 140, between there, 130 to 140, that's normal baseline. But what we're really assessing is when we see a uterine movement, which we do here, we see a rise in baby's heart rate, or a mountain. And that's essentially sometimes what they look like. This strip is really squiggly, so it probably really could use some adjustment on mom and it would be a little clearer. So that's essentially what you're looking for. Uterine movement, an increase in that baseline heart rate. The way we determine a reactive non-stress test is you have 2 accelerations in a 20-minute period. They have to last longer than 15 seconds, and they must be above 15 beats above baby's baseline heart rate. 2 accelerations in 20 minutes, lasting 15 seconds and 15 beats above baby's baseline. If the baby is less than 32 weeks, there's a whole different criteria. This is a reactive stress test. We will go over this again in class. I will bring more strips in to see. But in this particular strip, you can see that baby is having several. So this baby is wake little firecracker. And there is not an issue of getting the 2 in with in the 20-minute period, 15 seconds above, 15 above baseline. So this is a reactive strip. You want this. This is what we want. This is a good strip. Now we're looking at this strip in regards to the NST. This is a non-reactive strip. If you have a non-reactive strip, It needs further evaluation. It's extended for about 20 minutes or longer. If you have a mom who's in for an NST and it has been 40 minutes and it does not meet the criteria, they are going to do a BPP. So they are going to gather more data to determine what's going on. What makes a non-reactive test? The test does not demonstrate at least 2 of the qualifications and accelerations in like 2 of the qualifications that would make a acceleration in that 20-minute window. So you can see in this case, what are we looking for? 15 above baseline. We are looking for 2 accelerations in 20 minutes, and they have to last for 15 seconds. Here is movement, and there is no increase or anything you see different in that heart rate of babies. It is staying pretty much a nice stream, steady baseline heart rate. You do not see any peaks with the movement. Non-reactive. We don't want non-reactive. All right, now we are going to go to something called a contraction stress test. This can be done 2 ways. It can have nipple stimulation, which nipple stimulation tells the brain, and what particular part of the brain does it tell, or gland does it tell, to spit out oxytocin. That's one way. Or we can give mom oxytocin to stimulate a contraction. It is a very little diluted dose of oxytocin. We do not want her to go into labor, so it is not full strength, in order to elicit some type of a contraction. So these contraction stress tests, or CSTs, provide earlier warning of fetal compromise than the NST. It actually has fewer false positives. The reason they do not do these all the time is because we're giving mom oxytocin. They are expensive. They are considered invasive. And they cannot be performed on women who cannot have a vaginal delivery. They also cannot be done on preterm labor, moms with placenta previa, or multiple gestations, or if mom has had a classic incision, which is an up and down incision, or what you guys may know of as a midline incision from a cesarean birth. Same thing, mom comes in, she's put in a semi-Fowler's sitting position with a lateral tilt. She is hooked to the same thing, the transducer and the toco, so we can obtain the same information. We're looking at information from mom and from baby. If she's doing the nipple stimulation contraction stress test, she's just applying warm compresses to both breasts for several minutes, and then she has to massage one nipple for about 10 minutes. This is what's going to stimulate that release of oxytocin, and it comes from the posterior pituitary. You guys should know this because I know in med-surg you're doing endocrine. Plus we talked about it in NUR 226. If she does oxytocin stimulated, she is giving a diluted solution of oxytocin, IV. There's some measurements in your book. Don't get hung up on the actual dose. Just know that it's diluted down. And she's given that. And what we're looking for, or when we are interpreting a CST, you can have a negative, positive, equivocal, suspicious, or unsatisfactory result. A little bit more information as far as results go. The definitions of those results are on page 265, table 10-5, and they are just as extremely important as the NST, because I said you guys will see these again. Probably for me, probably for state boards. And you need to understand it and make sure that you don't confuse the results in the test. So we're going to look at a couple of strips to actually put the verbiage together with the strip. Okay, you are looking at 2 different strips, so I'm going to draw a line in between them. So the first one is A, and remember, top line, top strip is baby. We're looking for a baseline of the heart rate, and the bottom is mom. In this particular case, remember, mom has stimulated, whether it's nipple stimulation or we've given her oxytocin, a contraction. So when you're looking at contractions, they do look like mountains and peaks. So when we see a contraction, we need to know if there are 3 uterine contractions in 10 minutes, same strip, same time framing, 1 square 10 seconds, 6 squares or between the 2 dark lines is 1 minute, and it's about a 12-minute strip. So we need 3 uterine contractions in 10 minutes with no late or significant decelerations. What does that mean? Decelerations are extremely important in the mother-baby world. When I say a deceleration, that means mom has a contraction, baby's heart rate will dip down. So instead of a mountain, we're digging a hole. We don't want to dig holes with these babies' heart rates. That means there's some kind of compromise. We are going to talk further early decelerations and late decelerations, and they're very different in what you want to see and what you want to occur. Right now, I just want you to know that when you see mom have a contraction and you see a dig in a hole, that's a deceleration, and we don't want to see that, because if we see that, then we have a positive CST. We don't want a positive CST. This is where the terms are opposite in the interpretation of the two tests. So, negative CST is what we want. We want 3 uterine contractions in 10 minutes with no late or significant variable decels. No digging holes. This particular one you are looking at on A is a negative CST. That's what we want. Now we're going to look at the bottom one. The bottom one is a positive CST. So this is negative, and these pictures are from your book also, and the bottom is positive. So we can see mom is having a contraction. That one, sorry, wasn't very good example. That one just kind of didn't do anything. It just stayed baseline. But let's look over here. Mom's having a contraction. Here's baby's heart rate. After the contraction, so right about here, the contraction peaks, starts to go down, baby's heart rate goes down. That's where you're starting to see a late deceleration, and you do not want to see a late deceleration. So, what does it mean if it's positive CST? Late deceleration occurs with 50% or more of the contractions. And even if there are fewer than 3 contractions in 10 minutes. This mom, if she's in the office and having this done, she is going to labor and delivery, and she's going to get further evaluation, and she's probably going to have to deliver her baby because baby is compromised. Something is going on with that baby. It's usually a placental insufficiency, and that is not what we want to happen. If the placenta is compromised, baby is not getting oxygen. So for right now, with CST, that's all we're going to talk about. Negative, positive. In class, we're going to talk about the other 3 interpretations. The most important 2 are the ones that you're looking at right now. So we will talk further about these in class. And if you guys have any questions, bring them with you. We'll go over them again. And this concludes Chapter 10.